Back to the future. Imagine it's 1972. Republican incumbent Richard Nixon is about to defeat Democratic Senator George McGovern in a landslide for the presidency. After the lowest voter turnout since 1948, only 55%. That year, the last human crew landed on the moon. And the band KISS was formed. Hell yeah. KISS is still relevant. But also that year, a Swiss-born physician also testified in August at the first national hearing on the subject of death in front of the U.S. Senate Special Committee on Aging. Elizabeth Kubler Ross. She spoke of death with dignity, an evolving sense of hope for the dying, a state of mind that begins at a cure and ends at hope for the living, hope for their children and hope for their loved ones. She also spoke of a peculiar death-denying society. To isolate both the dying and the old serves a purpose in society, she said. They're reminders of our own mortality. Our own mortality. Well, we've heard a lot about our own mortality today. But what really happened in that hearing room in the United States Senate, what really happened that day in 1972? Well, I actually don't know from experience. I was negative 11 years old and clearly upset that I wasn't there. But at that hearing in a U.S. Senate committee, that actually, this committee has no legislative authority. Indeed, a Senate committee that cannot consider or pass bills. What happened is innovation. What happened is hard work, the really hard work to stretch and think and consider that death can be something else. The status quo that day was being questioned in this country. And a political curiosity and a will to change our system of care in America was born for us as a nation. That hearing asked, how could end-of-life care be improved through policy and politics? That was a crucial moment in that committee with no legislative authority. It fostered a sea change in this country. So fast forward to 1982, and after a series of Medicare demonstrations to test the concept, hospice became an enshrined benefit for anyone over the age of 65 with 6 months or less to live. Fast forward to today, 41 years later, and that benefit is largely unchanged. That's good for hospice programs in this country that rely on a daily, they call it a per diem, but a daily payment from Medicare. But is it good for people? Is it good for families in this rapidly changing healthcare environment in this country? Is it good for all of us as humans in America, even those humans in Congress? Yes, they're humans too. The spirit of that Medicare benefit passed by Congress over 40 years ago remains not just relevant today, but from my perspective, crucial. It's community-based. It allows people to get care in their home. It relies on an interdisciplinary team with support from volunteers, everyday people with extraordinary empathy and a desire to give, many of you in the room today. And a robust bereavement program, especially in our not-for-profit programs across the country. Dr. Kubler Ross that day sparked a movement not just in American hospitals and homes, but also in Washington, D.C., where I live and work, and my wife lives and works. She's out here somewhere. So I offer a simple question. Can we do that again today? Can we create a spark? Despite what you read in the news, Congress is still open for business, barely. And it's certainly behind the scenes in committees of jurisdiction for healthcare, even those with no legislative authority can spark a movement. Yet the problems remain quite clear, right? And we've heard some of the statistics throughout the day. About 10% of the Medicare population accounts for over 57% of the costs. Studies show that about 42% of individuals have had any conversation about end-of-life issues in this country. Only about 23% have put those care directives in writing or legal documentation. And almost half of doctors reporting they're unsure of what to say in an end-of-life conversation. And less than a third of doctors report any formal training. When asked where people wanted to die in America, about 70% want to die at home. About 70% do not die at home. Many of us, researchers are now even questioning, for people who have really medically complex conditions, is the home the right place to die? Controversial, but an important question. And all too often, individuals' goals, values, and wishes are not reflected in the type of care that they receive. And perhaps most important, are palliative care and hospice enough? Aren't we all pre-terminal? Shouldn't we get that care sooner? Well, we also know that the healthcare system and the many community-based interventions, it's evolving around us. You know, healthcare, a full fifth of our GDP in America. Health plans are looking more like providers every day. Providers are looking more like health plans. Payment and reimbursement in America is now more than ever based on value rather than volume. Not-for-profit entities are being challenged by growing interests of for-profit competitors and their venture-backed partners. Consolidation abounds. And non-medical services are becoming widely recognized as crucial to achieving better health and stronger communities. The healthcare system in our communities are evolving, people, around end-of-life care. So has hospice and palliative care been left behind? I say no. And especially not if we, you, me, nurture some spark. Any spark. And I think we saw sparks today. Sparks of design, sparks of personal stories, powerful personal stories, wow. Sparks of innovative approaches, sparks of love and compassion, and yes, human sparks that unite us all in empathy and in courage and in the desire to make this all better. I think we need a spark of reform in Washington, D.C. We need to ensure a care continuum in America, and what do I mean by that? With 10,000, we just heard it, 10,000 baby boomers turning 65 every day in America, the time is now to rethink how care for the dying is delivered and paid for. We're still talking about this. Hey, there's no interest, there is no industry, and there's no force at play in healthcare in this country and in markets that is exempt from the downstream and largely immeasurable impact of decisions that are made in Washington, D.C. None. As Tip O'Neill famously said, all politics are local. Remember that one? Yeah, but the largest forces in healthcare, policy, and politics are federal and state. And in that sense, we need federal and state solutions to improve end-of-life care in America. We need a system of community care that supports, that is seamless to the patient, to the family. Not the patient, the person. To the person, the family, to caregivers, that begins well before the end of life, and that relies on our patchwork system, but I would argue powerful public-private partnerships in the United States. That'll mean big changes in Washington. Big sparks. So what's the secret sauce? What's the most powerful force that we have to ensure that leaders understand what high-quality end-of-life care truly can be? To build and sustain this seamless approach? Personal stories. This is my mom. Don't those popovers look so good? Her specialty. She's been a hospice and palliative care advocate, volunteer, and leader in our community in Vermont since 1975. Yes, after reading Dr. Kubler Ross's On Death and Dying. I wonder if she saw that hearing in 1972. She's watching right now. I'm sure I'll get a text before I conclude of whether she was watching or reading about that, but she inspired me to do this work. She's my personal story. Here she is with Elizabeth Kubler Ross. She's there in the back. It was this is while Elizabeth was in hospice, it was the great honor of her career to be on that care team, really as a friend to Elizabeth as she neared the end of life. Yeah, she's pretty amazing. And this is President Biden and his late son, Beau. President Biden is not just the commander-in-chief. President Biden is the empath-in-chief. So politicians have stories too, human stories that can spark a policy that can transcend politics to ensure higher quality end-of-life care in America. And he's not alone. Senator Warner, Senator Capito, Senator Barrasso, congressmen, Republicans, cabinet secretaries, West Wing staff, they all have stories. And those stories unite us all in empathy, and they create a more powerful opportunity to tell our stories as humans. So imagine, one day you might find yourself in a powerless committee room. But your story, your voice, could be the very spark that ignites a movement, transforming how we care for each other at the end of life. Remember, it's not just about changing policies. It's about changing hearts. And that starts with a story. Thank you.